Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about military insurance triage, how to figure out which one to bill. Have you or your staff ever been confused about which TRICARE to bill for a patient? Have you had situations where you're trying to figure out, but you're not quite sure the questions to ask? Well, today's video is going to help with all of that. We are going to review how to understand which military insurance should be registered and billed for your patient's services. In my experience, it seems like the military insurances is one of the most misunderstood situations in healthcare at the front desk. The mistakes, unfortunately, can lead to a lot of bad things downstream, including incorrect eligibility verification, authorization failures, claims sent to the wrong payer, which is delaying payment, delayed reimbursement because of the things I just mentioned, and increased accounts receivable. So let's go ahead and just talk about why there's so much military insurance confusion in the first place, okay? The core problem is that many healthcare offices often treat military-related insurance cards as if it represents a different insurance company. And in reality, TRICARE in itself is the health benefit program that the patient has, okay? So that's something that needs to be understood in order to be able to do further questioning and investigation, okay? Tricare East or Tricare West identifies a regional contractor administering the benefits for those patients, okay? TriWest, which now most things in the Western region are TriWest as of 2025, can function as a network administrator or contractor depending on the program the patient has. And that can add to the confusion, of course. And then Tricare for Life coordinates with Medicare specifically, and it's always a secondary payer, okay? So we're gonna talk about these a little bit further to help. Some common front desk mistakes that I have seen when it comes to these insurances is treating the contractors as the insurance carrier, which isn't correct. Entering the wrong payer into the system, that's a huge one. Missing referral requirements, that's even bigger. Billing secondary payers as the primary insurance, especially in the Tricare for Life situation, and failing to identify Medicare coordination rules, okay? Always identify the benefit first when it comes to the military insurance, and then you identify who administers it, which helps you understand where to bill it. Okay, so let's go into understanding TRICARE in itself, okay? Because TRICARE is this big conglomerate that helps to understand the details in order to go further, okay? TRICARE is the Department of Defense's healthcare program, and it serves active duty service members, military retirees, eligible dependents, including spouses, National Guard and Reserve members, and then certain survivors for veterans who have passed. Okay. Think of TRICARE as the military health insurance benefit, and then you have to drill down further. The common plan types that you can find under TRICARE are TRICARE Prime, TRICARE Select, TRICARE Reserve Select, not to be confused with TRICARE Select, of course, TRICARE Retired Reserve, and TRICARE Young Adult. So your information that should be verified by the staff for this patient is it active coverage? What is the plan type, like we're talking about? If there's any referral requirements, if there's any authorization requirements, they are different. and network participation status as a group and as a provider as well. Okay, you have to have all these pieces understood in order to make sure that everything is billed correctly for the patient. TRICARE is the actual healthcare benefit, but there's different types of benefits within TRICARE. I hope you're figuring this out. So TRICARE East, let's talk about that first, is one of the most common sources of confusion when it comes to TRICARE benefits, okay? Many staff members will see the card, or a patient will say, I have TRICARE East, and assume that it's a different insurance plan, that it's separate. And it's not, okay? They need to understand this. TRICARE East means that TRICARE East is a regional administrator of the TRICARE benefits, and they manage the beneficiaries' information and coverage in the designated eastern states. Now, the website for TRICARE explains which states fall into which regions, and that is something you need to understand as well for your location and your practices. The contractor may handle, depending on the region, of course, because you're going to have West and East regions, the eligibility support, the provider networks, referrals, authorizations, and claims administration. Okay? TRICARE East itself is not a different insurance product. It's just telling you who administers in that region's military benefits that you need to deal with. So now let's talk about TriWest, okay? There used to be Tricare West, and people will still refer to it as that, but as of 2025, it kind of all merged into TriWest. It's synonymous for the same thing, okay? So it could serve as a contractor to manage provider networks, referrals, authorizations, and claim administrations as well. So you have to ask some critical questions if someone has TriWest. Is it TRICARE? Is it VA Community Care or VA CCN? Because that is another military insurance that we're not going into detail about today, but it can be involved with TriWest itself. Or is it another government-sponsored program, okay? So TriWest will act like a TRICARE East for your Western states that are assigned, but it also can handle other military government-sponsored programs like VA CCN, and you have to know the difference with that, okay? Some of the errors that you might see for front office staff is entering TriWest as a payer itself without determining which benefit program the patient is actually involved in, whether authorizations are required, and where claims should actually be directed, because it could be a contractor or it could be an administrator. And that's where a lot of people get extra confused. So just a good rule of thumb, when you hear or see TriWest for a patient, do not stop at that name, okay? You have to go further and identify the underlying benefit for the patient, the responsible payer, and the correct billing pathway specifically. So TriWest is going to be a little more tricky than TRICARE East. Then we come to understanding TRICARE for Life, and that one's actually, I think, the simplest of them all. And TRICARE for Life serves military beneficiaries who are eligible for Medicare. So if the TRICARE beneficiary does not qualify for Medicare, then they would not be eligible for TRICARE for Life. It's very simple, okay? The typical patient profile who has TRICARE for Life, now this is typical, it's not always, are military retirees, okay? They're age 65 or older. They are Medicare eligible, and they are enrolled in Medicare Part A and Part B, okay? So how this would work is the patient has Medicare as their primary insurance. Medicare is always primary when it comes to TRICARE for Life. Then once Medicare processes that claim, they're aware the patient has TRICARE for Life, so then they automatically will forward what's left to pay to TRICARE for Life. And then TRICARE for Life will process the remaining eligible balance if applicable, right? If it's within their structure. This is very simple. TRICARE for Life should never be billed as primary insurance. There is no situation that I'm aware of that TRICARE for Life would be your primary insurance because it's always a secondary to a Medicare patient's insurance plan. Okay. If you do this incorrectly, again, it's going to lead to denials, delays, and additional work for your staff. So just make sure that you educate your staff that TRICARE for Life generally means Medicare is primary, TRICARE for Life is secondary. Clearinghouses are going to have their own payer ID for TRICARE for Life because it is its own part of the TRICARE beneficiary programs. Really quick, I just want to review what the military triage insurance workflow should look like at your front desk, okay? So when a patient says they have TRICARE, you have to immediately identify the benefit. So what military health plan do they actually have? Is it TRICARE Prime, TRICARE Select, or TRICARE for Life? There could be other ones, but those are the three most common. Then, once you understand the benefit, you have to identify the administrator of those benefits. So you need to look for references such as Tricare East, TriWest, or if there's another contractor by chance. But remember that the administrator does not automatically equal to the payer. Okay, I know that can be very misleading and kind of counterintuitive, but it's true in this situation. Then once you understand that, you have to determine if the patient has a Medicare status at all. Are they retired? Are they 65 or older? Or are they disabled and qualify for Medicare because of a disability, right? So you have to ask, do you have Medicare? That is just something you need to ask. Then, once you kind of ask yourself all these questions and you go through it, you have to verify the requirements for their benefits, okay? So you need to check their eligibility, you need to check if they require a referral or an authorization to be seen, and what their network status is within your practice with your group and the provider that they're going to be seeing. Once you do that, you have to confirm where the claims are going to route to, okay? So who is primary, who is secondary, which administrator is involved, and where should the claim actually be sent for them when this insurance gets billed, okay? So the patient might have a different insurance and you have to figure out the coordination of benefits if it's not TRICARE for Life. The simple military insurance framework is that TRICARE is the healthcare benefit. Okay, just think of TRICARE as the healthcare benefit. The East and West are going to be your regional administration systems for the eligible TRICARE beneficiaries. But you have to remember that TriWest could also be a contractor, so that needs to be looked into a little bit further. And they might manage the referrals and authorizations or a network for a different type of benefit of TRICARE, but you don't bill TriWest directly, so you have to figure that out. You also need to see if the patient is a Medicare eligible patient, because then TRICARE for Life will play a role into that. And then you need to decide how you're going to establish and make sure that referrals, authorizations are obtained if required, how the claims are going to be routed, how they need to be entered into your system to ensure they go to the right place. Okay, so once you understand the foundation, then you can move forward with your own systems and your own SOPs and things like that in order to make sure that there are no mistakes upstream to affect downstream negative effects, right? When military insurance appears at your front desk, don't focus on the logo or the contractor name first. Focus on identifying the actual benefit of that person by asking the questions. Are you active military? Are you a dependent of someone who's active military? Are they retired? Are you retired? Are you Medicare eligible? Are they Medicare eligible, right? To determine whether Medicare is involved, and then depending on their answers, you'll know which benefit you need to look into, and then you can confirm who is responsible for actually processing that claim once you get all that information. Okay. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit from the information. I appreciate the support, and we will see you next time. Bye-bye.